So today we're going to look at how do we manage OA conservatively during COVID-19 and beyond. My name is Rosa Fojut and I'm the Regional Sales Manager and Consulting Orthotist at Thuasne UK. When we look at statistics, the knee is the most common site for osteoarthritis. Within the UK, there are around about 5 million people suffering with OA in the knee, and over 1.5 million of those patients suffer from severe knee OA. We know that 80% of unilateral knee OA patients develop bilateral knee OA within 12 years. The impact of knee OA and the cost to the UK economy and the NHS are massive. The figures I'm talking about here are quoted from Versus Arthritis and Oxford Economics. They quote 25 million working days are lost to OA and rheumatoid arthritis every year. They forecast the figures of between 3 and 14 billion pounds when it comes to the economy hit. When we look at the cost to the NHS, this figure is between 5 and 6 billion, with 120,000 knee replacements done annually. The effect and the cost of quality of life is around about 10 billion, so culminating in an overall cost of around about 30 billion pounds every year. If we look at the costing of bracing versus pain relief, long-term prescription of opioids for chronic musculoskeletal pain is common in primary care. The average annual prescription cost is £174 for patients prescribed from opioids, and approximately 40% of those patients receive more than 3 prescriptions a year. The cost of the bracing to the NHS that we're going to discuss is £195. So the costings are comparable, and there may be sort of good pros to not taking opioids if we can avoid that. We look at NICE guidelines. NICE guidelines recommend that adjunct therapies should be explored, that these therapies are cost effective, and pain relief without reliance on pain medication is often a really important factor. Adjunct therapies allow improved muscle condition, and they help us to maintain and the patients to maintain and improve BMI. Use of adjunct therapies also helps with better preconditioning pre-operatively, leading to better surgical outcomes and a quicker patient recovery. So how can we at Thuasne help you? So we are very much of the thought of bracing before replacing, or at least bracing to extend the time to replacement. So bracing is not only an option that can be used as a conservative management tool alongside exercise therapy and physiotherapy, but it's also a method that can be used to manage patients who are awaiting delayed surgeries. So this option can be used early on in the osteoarthritis diagnosis, but it can also be used later down the line whilst patients are awaiting surgery. Offloading knee braces have been proven in literature to reduce pain, improve function and improve quality of life. If you look at the stats around brace wear versus total knee replacement, this study by Lee et al. Showed that patients who wore a brace for more than 2 years did not require surgery 8 years at follow-up, that it was a cost-effective method to use for patients awaiting surgery on the knee, and for patients who wore the brace for 6 months or more, half their chances of surgery compared with those who wore it for 3 months or less. So this is a key and a really important factor when it comes to compliance and usability of a brace, and that's something we're going to cover later on. So a little summary for those who may not be as confident with how knee bracing and offloading bracing actually works. So offloading bracing is all to do with this 3-point lever arm principle. So this little simple video shows here exactly what 3-point offloading does. So we can see we have wear in the medial compartment. 3-point offloading applies a force system that helps us to open up and decrease the load that is sort of borne through the articular surfaces in the affected joint. This 3-point offloading helps us to offload the affected compartment, which improves pain, improves confidence and improves activity of the patient generally. This offloading and reduction in pain also allows the patient to have a more normalised motion. So they start to use the limb more normally. They start to reduce the antalgic gait patterns and the coping mechanisms they've been using because of the pain. And they get out of the vicious cycle of the knee being painful, so doing less exercise, so getting a stiffer knee, putting on weight, this increasing the pain through the knee, and that vicious cycle, which is really hard to break. So the pain relief helps them to get onto a virtuous cycle where they can normally load the leg. The normal loading of the leg and the increased activity helps to build the muscle strength, and the muscle strength improvement and condition in the muscles improving helps to stabilise the knee fundamentally to begin with. So how can patients access this brace? So the brace we're specifically talking about is called the Action Reliever, and it's indicated for unicompartmental osteoarthritis and unicompartmental conditions. So that may be meniscal tears, that sort of thing. If a patient has a degree of medial or lateral OA, but also has patellofemoral osteoarthritis, this brace can also be indicated as it has a patellofemoral ring that helps to compress and support the patella. The brace can be measured, supplied and fitted remotely, and this is in line with the British Association of Prosthesis and Orthosis guidelines, and it's in respect with social distancing. The brace is available in primary care, so it's available on FP10 prescription, and it's available on prescription in Scotland, Wales and Northern Ireland as well. The brace is also available in secondary care, and that may be through orthotics or surgical appliances, through physiotherapy and through plaster room. Orthopaedic clinics may also have orthopaedic nurses who are trained up to fit and supply these braces on referral of the orthopaedic surgeon. The brace can also be purchased privately. So I mentioned earlier the sort of main crux of brace wear being effective is the brace being worn and being worn for prolonged periods. So what makes the Action Reliever a wearable OA offloading knee brace? So when we look at it from a point of view of function, most importantly, it provides an effective 3-point force offloading. This helps with pain relief, joint stability, and the knitted construction of it helps with improved proprioception. From a patient point of view, the brace is comfortable to wear. So it's a medical grade compression, and this helps with suspension. It's adapted and can be adapted to the patient's morphology, with all the straps being trimmable and can be angled to unique limb shape. And the brace itself is mapped up to the underlying anatomy. So it's not just a uniform neoprene sleeve that may slip. It's actually shaped around the patella, around the sort of actual anatomy underlying the brace. From a user point of view as well, it is low profile and it's discreet. This is really important from a point of view of acceptance and the psychological impact that wearing a brace can have. So the lower profile, the more discreet a brace can be, the better patients accept the brace in most cases. From a point of view of use as well, it's easy to use. It's simply a pull-on design with magnetic buckles, so it's easy to fit and adjust. If we look at a presentation, this is a typical presentation of early onset left leg medial compartment OA following previous injury. There is medial joint pain, ligament laxity, and some level of medial compartment compression. Joint stiffness and crepitus is reported with lateral thrust and an antalgic gait pattern. The patient also reports sensitivity to kneeling and increasing difficulties with ADL's activities of daily life. The prescription of the Action Reliever was a left size for medial Action Reliever. So we prescribe the brace medial or lateral dependent on the compartment. This patient has medial compartment OA, so we prescribe a medial compartment brace. The Action Reliever creates a valgus pulling force that helps to open the medial joint space. It helps to improve alignment, stability and proprioception, and this in turn helps to reduce pain. We've set up lots of different resources through the COVID-19 pandemic to make this brace accessible for patients in their own home. So we've set up a step-by-step measurement video, which the patient can do in the comfort of their own home. We are here and on hand to be able to advise on sizing if a patient should require this. We have a really useful new website that has all these resources at the patient's fingertips. Fitting can also be done remotely. We've got a really good fitting video that takes the patient step by step. We also have a wear guidance leaflet which covers commonly sort of questions the patient has, and we also have virtual support that's available for clinical staff who may be fitting these braces in clinic or who want to be trained up to fit the braces. We also have the option of Thuasne fitting clinics, and we do quite a lot of these in the southwest, where the representative for the area, Tim Moore, will actually do fitting clinics where he'll fit the braces up on patients. So from a point of view of feedback, I always think it really helps to look at what the patient gets from wearing a brace. So these 3 patients have allowed me to use their words when I followed up on how they were getting on with their prescriptions. So the first patient says, "I found it straightforward to adjust. It has been tremendously helpful and allowed me to walk with minimal discomfort, which has helped the recovery process." The second patient says, "I've massively reduced the amount of analgesia and anti-inflammatories I use and have much less pain at night. Due to the reduction in pain, I've managed to be more active in general and to do some exercises to strengthen the surrounding muscles, which helps support the knee." And the final quote is from a perfect patient. "The offloader has arrived. It has been amazing. I started off with short walks with it and have worked up to longer dog walks. For the first time in ages, I have done a theatre list and not needed painkillers in the evening." So this patient was a patient who was on the front line and was really struggling to do her job within the NHS. And the knee brace has just allowed her to take that step to be able to continue her daily life, continue her job, and to manage it sort of without pain relief and without pain. So I'd like to thank everyone for listening. Because we're not live, I can't answer any questions. I've recorded this after the event. If you do have any questions, please get in contact with us. You can either get in contact with us through the customer services team, as the details are shown on screen, or you can get in contact with Tim Moore, who is our representative in the southwest. Thanks a lot for listening, and I hope to hear from you soon.